The Importance of Healthcare in America, written by Dr. Sanjay Gupta. Healthcare is a fundamental human right and a cornerstone of a thriving society. In the United States, access to quality healthcare is essential for individuals to live long, healthy, and productive lives. However, the United States faces significant challenges in providing affordable and accessible healthcare to all its citizens. The complexity of the healthcare system, rising costs, and disparities in access continue to be major concerns. Addressing these challenges requires a multifaceted approach that involves policymakers, healthcare providers, insurers, and individuals alike. Understanding the key elements of the U.S. healthcare system, recent reforms, and ongoing debates is crucial for informed decision-making. The Affordable Care Act, a new era in healthcare. The Affordable Care Act, also known as Obamacare, marked a significant turning point in U.S. healthcare policy when it was signed into law in 2010. The ACA aimed to expand health insurance coverage, improve the quality of care, and slow the growth of healthcare costs. One of its key provisions was the individual mandate, which required most Americans to have health insurance or face a penalty. The ACA also established health insurance marketplaces, where individuals and small businesses could compare and purchase health plans. Millions of previously uninsured Americans gained health insurance coverage, and the law introduced important consumer protections, such as prohibiting insurers from denying coverage for pre-existing conditions. However, the ACA has also faced criticism and legal challenges since its inception. The ACA remains a subject of intense political debate, with ongoing efforts to repeal, replace, or modify its provisions. Medicaid expansion extending coverage to more Americans. Medicaid, a joint federal and state program, has long provided health insurance coverage to low-income Americans, including children, pregnant women, people with disabilities, and seniors. The ACA's Medicaid expansion provision allowed states to extend coverage to adults with incomes up to 138% of the federal poverty level. Medicaid expansion has had a significant impact on access to care for millions of Americans. In states that have expanded Medicaid, uninsured rates have dropped dramatically, particularly among low-income adults. However, some states have opted not to expand Medicaid, citing concerns about costs and the potential for increased government involvement in health care. The debate over Medicaid expansion continues to be a focal point in discussions about health care reform. The individual mandate, a controversial provision. One of the most debated aspects of the Affordable Care Act was the individual mandate, which required most Americans to have health insurance or face a financial penalty. Proponents argued it was necessary to create a stable and affordable insurance market. Opponents argued that it was an overreach of government authority and infringed on individual liberty. In 2017, the Tax Cuts and Jobs Act eliminated the individual mandate penalty, effectively rendering it unenforceable. While the mandate remains on the books, the lack of a penalty has raised concerns about potential instability in the individual insurance market. The long-term impact of repealing the individual mandate is still being debated. One of the most significant achievements of the Affordable Care Act was its protection for individuals with pre-existing conditions. Before the ACA, insurers could deny coverage or charge exorbitant premiums to individuals with pre-existing conditions, such as asthma, diabetes, or cancer. The ACA prohibited insurers from denying coverage or charging higher premiums based on health status. This provision was hailed as a major victory for millions of Americans who had previously been denied coverage or priced out of the market. However, the future of these protections remains uncertain. Legal challenges to the ACA and ongoing efforts to repeal or replace it have raised concerns about the potential loss of these crucial safeguards. Protecting individuals with pre-existing conditions remains a top priority for patient advocacy groups and many lawmakers. The Affordable Care Act introduced health insurance marketplaces, also known as exchanges, to provide individuals and small businesses with a platform to compare and purchase health insurance plans. These marketplaces were designed to increase competition among insurers and make it easier for consumers to find affordable coverage. The marketplaces offer a range of health plans with varying levels of coverage and costs. To help individuals afford coverage, the marketplaces offer subsidies based on income and household size. These subsidies in the form of tax credits help lower the cost of monthly premiums, making health insurance more accessible to low and middle-income Americans. Navigating the health insurance marketplace can be a complex process. To assist individuals in understanding their options and enrolling in coverage, the marketplaces offer resources such as online tools, call centers, and in-person assistance. Medicare, a federal health insurance program, provides coverage to Americans aged 65 and older, as well as certain younger individuals with disabilities. Medicare is a vital safety net for millions of seniors, providing access to essential healthcare services such as hospital stays, doctor's visits, and prescription drugs. Medicare consists of several parts, each covering different aspects of healthcare. Medicare faces a number of challenges, including rising healthcare costs, an aging population, and the increasing prevalence of chronic diseases. These factors put significant strain on the program's finances and raise concerns about its long-term sustainability. To address these challenges, policymakers have implemented a number of reforms to Medicare in recent years. The Affordable Care Act also introduced several provisions aimed at strengthening Medicare, such as closing the donut hole in Part D prescription drug coverage. Prescription drug pricing, a persistent concern. The high cost of prescription drugs is a major concern for Americans, particularly those with chronic illnesses who rely on medications to manage their conditions. The United States has some of the highest drug prices in the world, and the cost of prescription drugs continues to rise faster than inflation. Several factors contribute to the high cost of prescription drugs in the United States. One factor is the lack of price negotiation power by Medicare, the largest purchaser of prescription drugs. Unlike other developed countries, the United States does not allow Medicare to negotiate drug prices with pharmaceutical companies, limiting its ability to leverage its purchasing power to lower costs. The high cost of prescription drugs has significant consequences for individuals and the healthcare system as a whole. The telehealth boom, COVID-19's impact on healthcare delivery. The COVID-19 pandemic had a profound impact on the U.S. healthcare system, accelerating the adoption of telehealth and other digital health technologies. Telehealth, which involves the use of technology to deliver healthcare services remotely, emerged as a safe and convenient way to access care during the pandemic. Prior to the pandemic, telehealth adoption was relatively slow due to regulatory barriers, reimbursement challenges, and limited awareness among both providers and patients. However, the pandemic forced healthcare providers to rapidly embrace telehealth to continue providing care while minimizing the risk of virus transmission. The rapid adoption of telehealth during the pandemic highlighted its potential to transform healthcare delivery. As the pandemic subsides, there is growing momentum to make these temporary measures permanent and to address the remaining barriers to widespread telehealth adoption. State-level reforms, a patchwork of solutions. While the federal government plays a significant role in shaping healthcare policy, states also have considerable authority in regulating their own healthcare systems. As a result, there is significant variation in healthcare policies and programs across the United States, creating a patchwork of solutions to the challenges facing the healthcare system. States have taken different approaches to expanding coverage, addressing affordability, and improving quality of care. State-level reforms can serve as laboratories of innovation, allowing policymakers to test different approaches and learn from each other's experiences. However, the patchwork nature of state-level reforms can also create confusion and disparities in access to care for individuals who live in different states. The future of healthcare, ongoing debates and potential solutions. The U.S. healthcare system is in a constant state of flux, with ongoing debates about how to best balance competing priorities such as access, affordability, and quality. The future of healthcare will likely be shaped by a number of factors, including technological advancements, demographic shifts, and evolving consumer preferences. One of the most pressing issues facing the healthcare system is the rising cost of care. Policymakers and healthcare leaders are exploring various strategies to address this challenge, such as promoting price transparency, encouraging competition among providers and insurers, and shifting towards value-based care models. The rapid pace of technological innovation is also transforming the healthcare landscape. By working together, we can create a healthcare system that is more affordable, accessible, equitable, and responsive to the needs of all Americans.